Good afternoon, everybody, and welcome. My name is Lisa Fox, and I'm the training specialist with South Dakota Healthlink. I'm pleased to welcome you to this fourth informational webinar. Next slide. Today's webinar will be Human Interoperability, Clinical Engagement. Please note today's webinar is being recorded and will be made available on our website for future reference or for those who might have missed this webinar. Next slide. Today's agenda will include a short overview of South Dakota Healthlink, the clinical engagement framework, the value for providers and organizations, customer success stories, and return on investment. Next slide. I am pleased today to have Heather Wolken from our Clinical Engagement Services team present this webinar. The rest of our team is below. We encourage you to submit any questions you may have into the chat box. We will capture those and follow up either directly or create an FAQs document. Before I turn it over to Heather, I wanted to remind attendees of the current funding opportunities we have available. We have funding opportunities to cover the South Dakota Healthlink interface costs until September 30th, 2021, and funding opportunities to cover membership fees until September 2022. Thank you.
Awesome, thanks, Lisa. So as we always do with these webinars, we'll start by giving an overview of all of the services we provide to our members here at Healthlink. So South Dakota Healthlink is a program that offers several core interoperability services and products to support our mission. We have the core products available listed the top of the list here. The first one is our point of care exchange, which is our platform that houses clinical history from organizations all over the community. This includes lab results, reports, medication histories, and clinical summaries that can all be accessed by providers and used to pull back meaningful, quick information when they need it. This tool essentially enables clinicians to spend less time tracking down medical records and more time treating their patients. So Notify has a similar goal, our clinical event notification tool. This tool takes information that could be searched manually in point of care, and it actually automatically notifies providers when this information is received. So let's say you're an outpatient clinic and you're wanting to track your congestive heart failure population to make sure that they're getting timely follow-up after discharging from an inpatient stay. This tool would allow you to subscribe to a notification that pings you right away when someone from that heart failure cohort is discharged. So that way you can get in touch with them for follow-up right away. You can also use this notification to go back in a point of care exchange and see some details about that inpatient stay. Maybe you want to see if any medications were changed during that visit, for example. That's a great example of how these tools can be used in conjunction with one another. We also have the ability to electronically support referrals and orders and results. This summer, we'll also have a new offering coming out. This is our population health analytics tool. This takes the clinical information that's separated by patient in the point of care exchange, and it aggregates it. So with this tool, you can run quick analytics on that information. Let me give you an example. So for that heart failure example, maybe you haven't been signed up to receive notifications, but you want to look back historically and you want to know who of your outpatient clinic with that primary diagnosis of CHF had an inpatient visit, let's say within the last 6 months, and also were not seen in the clinic since that event. This tool would allow you to go in there, define that criteria, and run that report to bring back that list of patients that fits with what you defined. So that's my quick plug on all of the products that make up South Dakota Healthlink, all of which are available to our members and covered by their membership. Today, however, we'll be talking through a professional service that's also available to our members. This is our clinical engagement service. So I'll give you an overview of what those services are and how they can help organizations when it comes to integrating all or some of those products I mentioned above into your specific workflow. So it's no secret that people can be pretty resistant to integrating additional technology into their workflows. I think we probably all experienced this situation at one point or another, but often we have one way of doing our job, and we don't always welcome the disruption when it comes to learning a new tool, right? So when we talk about methods for integrating HIE into clinical workflows, focusing on aligning people, process, and technology is really at the core. It's important for users to know where the real value and efficiency are found in an HIE and what that means to them and the hard work that they do every day. So we already know that interoperability enables better care coordination, right? Patients are attending hospitals all over the place and specialists all throughout the community. So interoperability is needed between providers more now than ever. That's a pretty agreed upon idea. It all makes sense, right? But the tricky part is how to get that HIE interoperability service or tool seamlessly integrated so that the provider can maximize their workflow and you can really see change. In other words, having the clinical history, the data available in tools can't be the end of the conversation. The tools need to be utilized to really reap the benefits of interoperability. So that's where South Dakota Healthlink Clinical Engagement Services can help. So let's take a look at what that can actually look like. So getting back to the point I mentioned a few slides ago, users need to know where the real value and efficiencies are and what that means to them in the hard work that they're doing every day if they're really going to adopt these tools. We've identified 7 key factors to figuring out what that message is and how to communicate it to get the right people so that you have the buy-in you need to get interoperability tools integrated into your organization. First is to really understand the need. This is that famous why question. What's your why? So starting with your group's why will be the foundation that we use to build the rest of our analysis off of. The next is the who, identifying those folks that need this clinical information to really do their job. We'll then work with you to understand the scope of these roles and what they're responsible for in their daily work. Workflow is really the key driver here. We're not looking for places to stick these tools to give providers one more step in their daily routine. The goal instead is to identify current processes that could be modified or replaced with an interoperability tool to make their life easier or their job quicker. So again, workflow really drives this process. Moving down the list here, once we've identified the who and the why, we can map out their workflow as it stands today and identify those opportunities. Let's say that we're talking to someone who's a nurse or an MA in an ambulatory PCP setting, and they tell us that usually maybe about twice a day, the provider will pop their head out of the door and they'll say, hey, my patient, Mr. John, he just told me that he saw a pulmonologist yesterday at Avera. Can you get those records so I can review them while we have Mr. John here in the clinic? This nurse says this stresses her out every time because she has to drop what she's doing, call over to the pulmonologist's office, ask them to fax her the progress notes from this visit, and then she's at the liberty of the pulmonologist's office to fax those, right? So sometimes she doesn't even get the fax in time, the patient leaves, and the provider's already on to their next appointment. This would be a great opportunity in her workflow to substitute with Healthlink. Not only is this a gap in her current workflow that could use some help, but it's also a pain point for that nurse. So they'll likely gladly adopt a new tool that could help her overcome this stress. So now that this opportunity has been identified, the next step would be to engage that user, provide them with the education and training they need to use the tools, and then follow up with them to get feedback as we go. This feedback can be key to identifying barriers to use. Many of these barriers we can likely solve, so it's really important to identify them early and find a solution. We've found that taking the time to go through this process when implementing in-route tools can be the difference between long-term adoption and success for providers utilizing these tools in their job. So going a little deeper into a really important point from the last slide, workflow is the driver and workflow analysis is key in this process. This technology must be aligned to pain points to ensure that the expected value is achieved. Role titles might be similar across organizations, but those responsibilities and the workflow can be really different. So, for example, a nurse in one clinic doesn't always follow the same workflow as they would in another. In clinical engagement services framework at Healthlink, our workflow analysis process incorporates all staff, and it really allows us to align Healthlink services to very role-specific needs. This need will be different from admin staff who are checking in patients to the clinical staff that are caring for patients. So the clinical engagement service team can help support identifying where within the workflow all roles can achieve the most value from Healthlink services. So what does this process look like? Getting started on clinical engagement services really ideally happens early in the process. So when the engagement team works with you on integrating your services into workflows, this really should start prior to even deploying the technology. The pre-deployment phase is critical, right? It's important to involve key members of the staffing model from the get-go so that we can all clearly understand that why and that who that I talked about earlier. We'll want to understand the responsibilities of those target end users we identified, and then understand their workflow as it is now, including those edge case scenarios that might not happen every day, but are a real pain point when they do happen. This means that we're prepared to go into that deployment with a personalized and relevant approach. Training sessions should include solutions that clearly fit into the role you've outlined and address specific pain points you've identified. We have our support documentation available as well as a resource. And then, like I said earlier, follow-up is a really important part of this process. It's vital in engaging users going forward, really. As we can identify pain points, we can get buy-in, and we can even give providers a clear understanding and good education on how to use the tools. There still might be barriers to use, and so we want to be diligent in finding those out early so we can figure out solutions. This follow-up support is also given when workflows change or new pain points are identified, so we can ensure that this technology stays aligned with that analysis we did in the beginning. And then, of course, the work doesn't stop there, right? There will be ongoing support and education around these tools as time goes on. We're always open to doing refresher trainings as new users come into your group or as workflow changes over time. And then, as I mentioned in the beginning, we're planning the go live of a really powerful new tool as well. So as more interoperability tools come along and we grow as a program, we'll want to be available and engaged with our members to make sure they have the support they need. So again, this is a view of what to expect throughout that engagement process with our team. So now we'll talk a bit about that pre-deployment work and what those meetings actually look like. Workflow optimization is often deferred to post go live. It can seem overwhelming and it's often put off. If you're in a situation where you started the rollout process for Healthlink and you want to revisit clinical engagement, we can certainly work with you on that. However, in our ideal framework, the process really starts pre-deployment with a discovery meeting. This is that initial setup call where we'll meet and we'll talk about the services that we offer. We'll understand your current high-level as-is workflow as an organization. And we'll also review your staffing model along with roles and responsibilities. We can identify any business objectives or strategic initiatives specific to your organization, and we'll want to stay aligned to those. But really, this initial discovery call is an opportunity for both sides to get more perspective on the job ahead so we can both decide on those target user groups and next steps together here. The discovery process is where we'll also identify use cases and we'll tailor them to specific departments or staff roles to be able to demonstrate the value to those groups. This step really allows each individual role to understand the benefit of Healthlink and what that tool can bring to the hard work that they're doing every day caring for patients. The idea here is to be able to tell providers right away what's in it for them, what pain points we're solving so that they get it right away and they're really willing to learn. Again, we'll also provide that education for these teams and documentation to help them learn. This whole process is really tailored around getting providers what they need to be successful using interoperability tools. All right, so if all of that sounds overwhelming or like a lot to take on, just know you're not alone. We're here to work through it with you just one step at a time. And I'll admit this process can certainly be a challenge, but I want to reassure you that even small changes to clinical workflows can really make a big difference. So we want to share an example with you of a provider workflow where interoperability services were aligned to specific staff roles and pain points were identified using our clinical engagement framework. As you can see, this workflow takes a holistic approach and incorporates every step in the patient visit. It starts with that when the patient presents for their visit, how the doctors, nurses, and staff interact with each other and with the patient, all the way through the end when the plan is established. Notice that several roles are involved in this process, and there are multiple points where Healthlink was able to be utilized. Interoperability requires this holistic approach in order to achieve the workflow efficiencies and improved patient outcomes that we're after. So at first glance, a new technology seems like a really easy, quick way to implement positive change, and that's not wrong. However, organizations that don't do a proper workflow analysis, we see often struggle in adoption of these tools, and end users struggle as well, knowing where these tools fit into their day-to-day. So optimizing clinical workflows in healthcare delivery organizations can help ensure that the best possible care is provided to patients and clinical outcomes are strengthened. When clinical workflows are fine-tuned, common bottlenecks that hamper patient flow are reduced, and increase in efficiency means that patients can spend more face-to-face time with their clinicians. This really is the ultimate goal of clinical engagement work like this, and it's the ultimate goal of interoperability tools. All right, so I'll take a step back here and I'll touch on something we might all have on our minds. We talked a lot about different technologies that can use a patient's clinical data to improve workflows, save time, and generally make patient care more efficient. Well, unfortunately, efficient isn't a metric, right? It's really tough to say I'm 45% more efficient. But what you can do is you can define some specific measurable KPIs to help you prove that you did make these changes for a reason and you did improve. So that's what I'll touch on briefly next. So as a program as a whole, Healthlink, and especially part of this clinical engagement professional service, we want to highlight the importance of key performance indicators and their role in process improvement. We don't encourage making changes for the sake of making changes, right? Disrupting a process and introducing new technology and services that are completely new to your organization is a big decision, and change is rarely easy, even if it is positive change. We want to put an emphasis on defining what's important to you, what aligns with your organization's goals, and what is achievable and measurable. We can help you define what fits well for your organization in that context. So earlier, I brought up an example story about a congestive heart failure group. I mentioned that this clinic wanted to use clinical event notifications to follow up with these heart failure patients. And for example's sake, we'll get more specific. Let's say they wanted to follow up within 3 days of being discharged from any inpatient or emergency visit event. This decision is likely tied back to a very specific KPI that they set. Sounds like they might have set a goal to decrease readmission rates for this heart failure population. They know that if they can re-engage with those patients and make sure they're getting what they need after their discharge, that they'll have a lot better success in preventing those readmission events. So again, this is an example of how a very specific workflow change utilizing technology can be put in place to serve a greater goal. This ambulatory clinic set out to reduce readmissions. They set a goal of outreaching to recently discharged patients within 3 days with that goal in mind. And then they used Notify to make sure they were able to give the information and tools their providers needed to achieve that goal. It was all very intentional and targeted. So these key performance indicators are really visibility into the changes that you're making and the impact you're having on your organization. If there are KPIs that your organization is targeting, we can incorporate those into our clinical engagement process to make sure that your actions are aligned with your goals when working with Healthlink. All right, another quick plug here before we go. I do want to give a preview of the webinars that will be coming up in the next few months. We're doing these on a monthly cadence now. So in June, expect one on closed loop referrals. And in July, we'll present on our electronic orders and results capability. Additionally, all of our past webinars are recorded and on our website at sthealthlink.org to be viewed on demand. And then lastly, I've dropped our contact information here. As a growing program, we're often adding new members, we're growing our network, and we're adding services. We know that a lot of you may already be participating in Healthlink, but if you're not, I don't assume that you've heard of us either. So feel free to reach out about anything you heard today. And thank you so much for your time.